Hello and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister.
Good morning.
Hi, thank you for having us today. Now, before we get into COVID updates, let's talk a little bit about cervical cancer. January locally has been designated the month for cervical cancer awareness. So let's talk a little bit about the management during this pandemic. Has the management of cervical cancer patients been a challenge over the last few months?
Well, thank you very much again. The reason why we have dedicated January as Cervical Cancer Month is to really bring a focus on cervical cancer. This is the second most prevalent cancer among women in Guyana, and the first being breast cancer. But this is a cancer that is preventable. I don't think a lot of people realize that. If we do the right things, we can actually prevent and eliminate cervical cancer from Guyana. And that is why we want to heighten the awareness about cervical cancer. In our framework of how we are approaching cervical cancer, we looked at three major ways of preventing it, and that is what is called primary prevention, secondary prevention, and tertiary prevention. In terms of primary prevention, we have found that there's a vaccine, HPV vaccine, that is very effective. And if we can immunize girls between the ages of 9 to 14, and we do this across the country, then over time we'll be able to eliminate breast cancer, because once they receive this vaccine, it would prevent them from developing the cancer in later life. However, since we haven't had widespread distribution of this vaccine, we have had some starts and stops with the vaccine. So in the period when Dr. Ramsaran was the Minister of Health, we started that program with HPV, and then that program kind of went into some level of dormancy and was restarted by the last administration, but again, it didn't last for very long. We currently have, in terms of our HPV vaccination rates, with the first dose of the vaccine, it's probably about 30-something%, and the second dose is really about 13 or so percent. So that's not really very high, and it's not going to be very effective. So one of the things that we'll be doing over the next couple of years is really to improve the uptake of these vaccines, because around the world they have been shown to be very effective against the prevention of cervical cancer. So during this month, we'll use the occasion to get people to understand more about the benefits of HPV vaccines, the primary prevention, and what you can do, how you can get involved, and why we need to do this. The second level of prevention that we work on, if we miss people at the early age, then that's not the end of the story. If we have women coming into our clinics, we'll be able to do what is called visual inspection. So VIAs have been very popular. We've introduced them maybe about 10-15 years ago. And we started that program basically with HIV women, because we found that persons who were more sexually active and persons who have had STIs were more prone to have, or they were at higher risk for cervical cancer and HPV infections. So we started a program with a subgroup of HIV women many years ago, so as to prevent this from happening. And then once we detect changes, we were able to then provide some level of treatment. So since then, we have expanded that program from one where it was limited to HIV positive women to now the entire population. And while initially we had probably about 5 clinics, now we have more than 20 clinics that are across the country. Unfortunately, not many women use the opportunity to go and check themselves to ensure that they don't have cancer. And this is another area that we want to ensure that women come for this type of screening. So we're able to offer VIA, and we are also able to offer pap smears. And if we detect any abnormalities, then we can provide the right treatment at that point in time. If, however, that is missed, then these cancers will develop, and the only other resort that we'll have, and which would be later on in life, and of course the malignancy would have developed by then you'll have to come in for surgery. And our hospitals, we are capable of doing these surgeries, but we prefer that we are able to detect it earlier. Once we do the surgery, then persons might have to do radiotherapy and so forth, and that also helps to manage the malignancy that you have. So we have this 3-tier program, but again, we would prefer to catch it earlier and even to prevent it from happening. And the focus now is to shift more to primary prevention using vaccination. And of course, while we're doing that, there'll still be people that we'll have to keep working on screening, detecting it, treating it, to make sure over the next couple of years that we minimize the amount of cancers, cervical cancers that we have. We are right now restructuring the ministry's chronic non-communicable disease program with specific focus, and one of the areas of focus obviously is cancer. In females, we are going to focus on breast cancer and cervical cancer, and in males we are looking more at prostate cancer. Between these 3 cancers, they account for the majority of cancers that we have in Guyana. And we believe that if we have strong programs that can address at least these 3 types of cancer, then we can really reduce the burden of morbidity and, of course, mortality with these types of cancer. That does not mean that we'll be ignoring the other types, but we want to have a dedicated focus on these 3 types of cancer. So during this month, we'll be sharing a lot of information, trying to get people more aware about what they can do to prevent cervical cancer. And we really want to encourage people, especially young girls, to start thinking about getting the HPV vaccine.
Okay. Minister, you mentioned prostate cancer. You outlined in detail what you were doing for cervical cancer, and of course, we know the program for breast cancer. But as it relates to prostate cancer, a lot of men are very skeptical about going and get themselves checked. What advice do you have for them?
Well, again, we'll be rolling out very specific programs, just like how I have elaborated with cervical cancer. We'll be working during this year with the International Atomic Energy Agency, who has, in 2018, they did what is called an impact study, where they came to Guyana with a team from the WHO, the IAEA, and they were able to look at all the services that we have in terms of cancer and make some recommendations. I have since invited them to move from the level of having just an impact study with recommendations to now working with us to develop a specific cancer control program. And these 3 areas that I have spoken about are the 3 areas that we'll look at, plus others. So we'll be working with them, and you will see a more detailed, more elaborate program pertaining to various types of cancers in Guyana. So in the next couple of months, you will start seeing a more detailed plan unfolding. As it relates to prostate cancer, indeed, men's, the kind of health-seeking behavior has not been there, and men tend to only come to the health center, the health facility, when they are really, really sick. And that's not what we want. What we want is to make sure that we can prevent, and therefore they need to come earlier. There have been various tests that have been available, but they're not recommended for routine screening. But if the person, if they have signs and symptoms, they have some problems, then the better thing to do is for them to come to one of our facilities so that the urologists can do a proper checkup and advise them accordingly. In addition to that, we have within the ministry a fledgling men's health department. And apart from touching on things like prostate cancer, we are going to grow that department so that we can look at other health conditions that affect men as well.
Okay, thank you so much for that, Minister. Now let's look at COVID-19. Over the weekend, I noticed that on social media that several businesses were ordered to shut their doors because they were in breach of the COVID-19 guidelines. Can you say what may have spurred this decision, and can you confirm whether or not these businesses were given any warning prior to this decision being taken?
Well, Operation Coffee Curb is an ongoing one, and the task force has constantly been asking that they go out and visit businesses to check how they have been complying with the regulations that we have put out. And a lot of people have been abiding by them, but there are others who have been breaching them. This really is irresponsible behavior because it puts people at risk. And it cut both ways, because it's, while the businesses might want to open up to try to, get their sales or whatever they're doing, it's also, people must understand too that we're in a pandemic and should also be, responsible. So if you know that the orders that we have put out clearly stipulates that there shouldn't be bars being open or having indoor dining, then why are you even patronizing an establishment that is in clear violation of these rules? So people ought to be responsible as well as these businesses. And we have been sending out warnings to various businesses across this country. And the task force, as I said before, would be ramping up its operations. So people need to be vigilant. Businesses need to comply with these regulations because they're there for a reason. And that reason is to prevent the spread of the disease in Guyana. So if everybody assists us, if we work collaboratively, we can all protect each other's health. But if we are going to violate these regulations, then it's going to create problems for all of us.
Okay. Minister, there's talks also that some businesses are being ordered to close, but others are given a free pass. What's your opinion on that?
Well, we have written to everybody, and if there any institution that people are aware of that we have given a free pass to, then I'll suggest that they contact the task force secretariat and bring that to our notice, because nobody is above the law.
Okay, thank you for that, Minister. Now, before we move on from that in particular, can you explain again for emphasis the dangers of indoor dining?
Well, it's a simple thing, really, because you're in an enclosed environment. Transmission does not only happen because of droplets. Transmission would also occur because of aerosols. And in an enclosed indoor environment where there isn't much circulation happening, and if you're going there for dining or drinking, obviously you would not have on a mask. And without a mask, if you are asymptomatic, you would be shedding the virus. So when you talk, you cough, you're having a drink, these viruses can escape from your mouth, your nose, and would go into the environment. So it circulates in the air, and other people would be breathing it in. So if that happens, then that whole space becomes a contaminated and polluted space. And because these things are so tiny and invisible, the other person who's there would not know that they're in a contaminated environment and would be breathing in the virus, and so they'll get infected. So it's a very simple thing, and I really don't understand why people can't get that up to now. So we need to make sure that in these types of environment that we don't have dining, because you're going to have problems. If we're in an environment like this and you're drinking, you're going to have problems. So these indoor environments are very, very problematic. And that's why they've been restricted. Look at what is happening in other parts of the world. Based on the science, they have closed bars and restaurants because they know that indoor environments are conducive to carrying the virus. So why would we be any different? And that's why we have this in our regulations, and we are asking people to please comply with them, because you're going to be protecting people's lives. And it's as simple as that.
Okay, Minister, thank you for that. Now, I know the COVID-19 vaccine task force would have met last Friday. Can you give us a brief summary of what took place and when the next meeting is expected to take place?
Well, we've had the first meeting of the task force, and we went through a number of things outlining the where we are in terms of readiness for our vaccines. What are the steps that we need to take, how far we have gone in taking some of those steps, and what are the other things that we need to put in place. So I think it was a very good meeting. We had presentations from various persons who were looking at different aspects of rolling out the vaccines in Guyana. For vaccines to come to Guyana, for example, you need to make sure that the right regulatory environment is in place. We've had a presentation from Dr. Marlon Cole, who explained what is the requirements for registration of new vaccines in Guyana, and therefore we'll be following those to comply. In terms of the cold chain, we have to make sure that our cold chain is in place, and a discussion ensue about what we need, where we are, and what we'll be doing. And then, of course, once we receive vaccines, how are we going to deploy them? The task force and its members have agreed that we'll meet at least once a week for now until we have all the pieces together. And various members of the task force have been tasked with doing presentations so that they will be sharing their expert knowledge at the next meeting. So I think we are off to a very good start, and I want to once again thank all the members who have agreed to be part of the task force. And while this would be the main body, we envisage that they'll have a number of subcommittees, and other persons with relevant expertise would be incorporated into those subcommittees as well.
Okay, thank you, Minister. Now, I have some questions from the Guyana Chronicle for you. Do you believe these abnormalities that show that the S gene drop-off discovered in the sample tested by the Eureka Medical Laboratory warrant for further genetic analysis?
Well, first of all, I think the Chronicle should check in with Eureka Medical Laboratories, because as far as I'm aware, none of what is out there in the public domain has been reported to the Ministry of Health. I know, as a matter of fact, that Eureka Medical Laboratories does not have the capability of doing the genetic sequencing of the virus, and since they don't have that capability, whatever they're doing, they might be making inferences, but that's not good enough in this particular instance. So if the Chronicle would want to find out more, perhaps they can ask those direct questions to Eureka Medical Laboratory to explain how they can find deletion of the S gene when everybody else can't find that.
Okay. Another question from them is, CARFA is in its progress report dated January 4 indicated that the Caribbean region has a very high risk of importing the UK variant, which they dubbed variant of concern 2020-1201. Do you believe Guyana is also at a very high risk of importing the virus, given that we have not restricted travel?
Well, CARFA has been working with all the member states to discuss this new variant. And at the very first meeting after the UK announced it, CARFA explained what was the latest information that we had and also advised what step should be taken. And that advice did not include shutting down any kind of transportation arrangement between, say, the UK and countries. That was left for the individual countries to do. And I think in the Caribbean, you had Jamaica, who then banned travel between the UK and Jamaica, and maybe there's another Caribbean country that did similarly. However, since we're not doing genetic sequencing, it is going to be very difficult to unearth whether or not we have that strain in the Caribbean. It is only if we have a very proactive program of surveillance using genetic sequencing that we'll be able to detect this. That's how the UK was able to detect this type of mutation, because about 10% of the persons who they test, they automatically take those samples and do genetic sequencing on them to look at the mutations that is happening with the virus. We have not, and when I say we in the Caribbean, have not established such a surveillance program using genetic sequencing. And until we do that, it is going to be very difficult to analyze what strains we have circulating in the region. So perhaps as a Caribbean region, we need to build that capacity. In the interim, CARFA has set up a project where they would be able to do a limited amount of genetic sequencing, and countries are invited to send at least 10 samples to them per month so that they can do the sequencing. Out of that, then maybe we'll start building a picture of what strains, what types of viruses are, or what clades of the virus are circulating in the region.
Okay, Minister, wrapping up, again, another question from the Guyana Chronicle. I know you would have mentioned and emphasized that Guyana does not have the capability to test for the variant, but will the ministry issue any guidelines detailing what private facilities should do should they discover any such abnormalities?
Well, I mean, it's a redundancy in the question, because they're not testing, they can't test, they don't have the capability of testing, so what would they report? But just so that it's abundantly clear, for public health purposes and as contained in various laws that we have, these things are reportable to the ministry. And the labs have been advised that they need to report this, and so that if they, by some means that they have that is unknown to us, have been able to detect these various strains, then they ought to report that to the ministry. As it is, as of now, we have not received any such report from Eureka Medical Laboratories. And I've asked last week the Chief Medical Officer to write to Eureka Medical Laboratories for the results that purportedly they have of these new strains that they have discovered in Guyana. To date, we have not received any such reports from them, and we'll await to see whether any would come this week.
Okay, thank you very much for your time today, Minister. This has been DPI's COVID-19 update. For more information, visit our website dpi.gov.gy or our social media platforms.